Do you know what stammering is? Have you ever wondered how it affects people? Well, stammering, also known as stuttering, is a speech disorder that disrupts the normal flow of speech. This disruption can manifest itself in repetitions of sounds, syllables or words, prolongations of sounds, or blocks where the individual is unable to produce any sound at all. It's a condition that varies in severity and often comes with a side of physical tension, anxiety, and avoidance behaviors related to speaking. Now, stammering isn't a one-size-fits-all kind of disorder. It actually comes in several types. First, there's developmental stammering. This typically begins in childhood, often between the ages of 2 and 5, as children are learning to speak. This type of stammering can persist into adulthood. Then, there's neurogenic stammering. This type is associated with neurological conditions or injuries that affect speech production. So, if someone has had a stroke, traumatic brain injury, Parkinson's disease, or other neurological disorders, they might develop neurogenic stammering. The third type is psychogenic stammering. This is linked to psychological factors like stress, anxiety, trauma, or emotional difficulties. It can occur suddenly in response to a specific event or situation. So what causes stammering? Well, it's not exactly clear-cut. It's believed to be a combination of genetic, neurological, psychological, and environmental factors. Some potential reasons include genetic predispositions, differences in brain structure or function, psychological factors like stress or anxiety, developmental factors during language acquisition in childhood, and environmental factors like family dynamics and communication patterns. In summary, stammering is a complex speech disorder with a range of contributing factors. It can be developmental, neurogenic, or psychogenic in nature, and it can be influenced by a mix of genetic, neurological, psychological, and environmental factors. But the good news is that with early intervention, speech therapy, and support, individuals can manage and even overcome stammering. It's all about improving communication skills and enhancing quality of life. Remember, understanding is the first step towards acceptance and improvement, so let's keep the conversation going.